Thank you for joining us. Today is an exciting day. This will be our last COVID update. We're making an announcement today with regard to the steps we have taken to slow the spread of the virus and preserve our hospital capacity. So you may all recall that it was on March 6th of 2020 when the state recorded its first case of coronavirus. Over the last 15 months, Nebraskans have sacrificed. They've spent time apart from each other. They've figured out how to manage their businesses with the pandemic restrictions. And they've worked hard to be able to keep our state moving forward while slowing the spread of the virus to protect our hospital capacity. And for 15 months, we've been successful at slowing the spread of the virus to preserve that hospital capacity. There was no point where we didn't have that hospital bed, that ICU bed, or that ventilator to be able to provide to people. And as of this morning, we're at 73 hospitalizations, which represents less than 2% of our overall hospital capacity. We've been there for over a week now, and this is the lowest number that we've recorded since the state started keeping track of those hospitalizations last April. For the last 7 weeks, we've seen our our cases also continue to decline, and over the course of the last week, our cases per 100,000 have been less than 5. So for 15 months, Nebraskans sacrificed. When we asked them to do that, they did it. When we had our 21 days to stay home, stay healthy, stay connected, Nebraskans did that. When we asked them to use masks, because recall we did not have a statewide mask mandate, they did that. So by educating Nebraskans about the steps they could take, Nebraskans did what they always did. They take care of their neighbors. They step in, and do the right thing. And so we're very excited today to make announcements with regard to moving forward. So earlier this morning, signed an executive order that will be canceling a number of the executive orders that I signed last year with regard to the pandemic. This executive order will cancel executive orders 2006, 2006, 2009, 2013, 2014, 2019, 21, 2021, and 2022. And here's that executive order right here that I signed. So you can't see it. On this page right here, there's my signature. See? I wasn't kidding. I signed it. So that terminates those executive orders. Those executive orders had to do with the regulations with regard to the Liquor Control Commission and allowing bars and restaurants to be able to do takeout alcohol that you may recall that we did. Also waiving regulations on the examinations for and audits for financial institutions, waiving regulations with regard to unemployment benefit eligibility, suspended certain regulations during short-time compensation plans, waived motor carrier regulations, and then also Department of Labor more flexibility for processing unemployment claims. So all those executive orders are no longer in effect. We are also getting all of our teammates back into the office as well to be able to return to normal operations at the state government. Then we will be issuing a DHM or issued a DHM today that will basically end our directed health measures at 11:59 tonight. So the requirements to quarantine and isolate will no longer be in our directed health measures, and that will end effective on 11:59 this evening. And then finally, we are withdrawing from the federal pandemic unemployment insurance plan. That paperwork has been submitted to the federal government, and that will become effective June 19th. So a number of steps that we are making to move forward. And so we're encouraging all Nebraskans to move forward together, all the organizations that we have to take that step moving forward. We're not going to require masks anywhere. And certainly if somebody wants to wear a mask, That is their personal choice, but I'm encouraging all organizations to set aside those pandemic rules and move forward together as a state. Also, I want to reiterate, though, while we have made tremendous progress in getting people vaccinated, we've gotten over 53% of our population is fully vaccinated, over 60%, the eligible population, I should say, has received at least one vaccine. 975,000 Nebraskans, over 975,000 Nebraskans have received at least one vaccine. That's tremendous progress. Please, continue to get vaccinated if you have not already. If you've received one shot, go back and get the second shot. Vaccines work. We know this here directly in Nebraska. And I'll just illustrate it with one case. We had a long-term care facility that they suspected they had an outbreak. So they tested the residents who had been vaccinated. And 23 residents tested positive. 21 of those residents had no symptoms. 2 had very mild symptoms. Vaccines work. It generated the immune response to make sure that the vast majority of those residents didn't even know they had contracted the coronavirus. Vaccines work. It prevents people from going to the hospital. It prevents people from dying. So please, if you haven't already gotten your vaccine, get the vaccine. They work. So, as we move forward together, I want to thank all Nebraskans for what they have done over the last 15 months, the sacrifices they have made to be able to help slow the spread of the virus, preserve our hospital capacity, and help us live a more normal life. Now it's time to return to normalcy. And so to talk about that return to normalcy, we've got 2 guests here today. Starting with my lovely wife, Suzanne, our First Lady. She's going to talk about Reconnect Nebraska. Now, as we all move forward, we want people to start reconnecting with those other folks that maybe they haven't seen in over a year, or get back to doing the volunteer work you used to do. We want you to support our restaurants. Go to the park. Go to the museum. Go to the farmer's market. Let's start reconnecting with the things that made this a good life. We want people to move forward to get back to the great things about our state that make it so special. And so our First Lady is going to talk about that Reconnect Nebraska as we encourage people to return to normalcy. So, Suzanne? I don't even have to step away anymore because we're not doing that anymore.
Well, we weren't socially distancing anyway.
We weren't socially distancing.
There were days, though. Anyway, hi.
During the quarantine, yeah.
Thank you for letting me be here. This is a great day for Nebraska, something we've been looking forward to for a very long time, and I'm so thrilled that I can be here today. I want to start out by thanking all of the amazing healthcare providers, the public health officials, the state and local leaders, the nonprofit organizations, and all those whose unwavering work helped to bring us to this point today. Thousands of caring and compassionate Nebraskans have stepped up in big and small ways to help one another, and we've been through so much, and I think that our state has done an amazing job of just shining brightly. In December, we launched the COVID Memorial Wall so people could pay tribute to those that they've lost to COVID. We continue to collect those stories and those memories, and the virtual memorial wall, it can be found at neimpact.org. That's the letter N, the letter E, impact.org. And I encourage everyone to go and visit that site and see some of the amazing posts that have already been placed there. But today, I'm happy to announce the launch of Nebraska Reflects. It's an online platform that allows Nebraskans to honor and tell stories about individuals who made a difference to them during the pandemic. It's an opportunity for Nebraskans to pay tribute to those who went above and beyond to help them. This might be a nurse or a doctor. It could be a teacher, a parent, a neighbor, a friend, someone who positively impacted their lives and provided encouragement and resources during this rough time. Your stories will help us chronicle the real-life impact of the pandemic for future generations. This can be found at neimpact.org/reflects. That's the letter N, letter E, impact.org/reflects. So please visit there and tell your story. Additionally, the state begins to open back up and life can return back to normal. And I encourage everyone to step up again and get involved in the volunteer activities. We have a long history of volunteerism in Nebraska, to the point that we consistently rank in the top 10 nationally for volunteerism. And through service, volunteers help to build stronger communities and provide assistance to those who need it the most. And many opportunities await you. It could be at your church, at a food bank, at a homeless shelter, at numerous mentoring programs. I encourage you to visit nevolunteers.com. That's nevolunteers.com to connect with opportunities in your community. There are around 150 organizations registered there, and you'll be able to find a place that suits your interests and your skills, a place where you can utilize your time, talent, and treasure in order to help your community. And if there are churches, organizations, and communities out there interested in being a part of that website so that you can register your organization and any volunteer needs you have, visit that same site, nevolunteers.com. If you're unable to volunteer at this time, I ask you to consider making a financial contribution to an organization or cause that's close to your heart, because there's still so much need out there, and these organizations need your help. Again, I want to thank all of those who have worked so hard to bring us to this point. It's an exciting day. I'm glad I could be a part of it. So, thanks, dear.
All right, thank you, honey. And again, we want people to reconnect. So reconnect with those people and places you may have missed out on over the course of the last 15 months, whether it's that volunteer work, your house of worship, your favorite restaurant. Please reconnect. And on that theme of helping us all reconnect and supporting things like restaurants and hotels and tourism, we have John Ricketts here to talk about the Nebraska Passport Program. Nebraska Passport is something the Department of Tourism has done for a number of years. Last year, they had 1,185 folks at 70 stops throughout the state. The program runs from September 1st through the end of September, May 1st through the end of September. And John Ricketts, our Director for the Department of Tourism, is going to come up and talk to us a little bit about that. John?
Thank you, Governor. Good morning, everybody. You know, it didn't really take me a long time to realize that the word reconnect has deep roots in the travel industry. You know, in many ways, those two words, travel and reconnecting, they're synonymous. And that's because if you look at the information out there, more than 50, and it's probably approaching 60% of people who, when they travel, either travel with friends and family, or they travel to go see friends and family. So on behalf of the tourism industry, we're really excited to be here today to help kick off the Reconnect initiative. Now, we already know, thankfully, that the recovery of the tourism industry has already begun. So we're really excited today about being here and giving some people some ideas and encouraging them to get out this summer. You know, whether it's going to Nebraska Land Days in North Platte, the Olympic swim trials, or the College World Series in Omaha, the Old West Balloon Fest out in Scottsbluff, Gearing, actually Mitchell. This summer they're all back. The National High School Finals Rodeo here in Lincoln, or the 100th anniversary of Nebraska's Big Rodeo in Burwell. Each is truly an opportunity to reconnect with the people you know, the places you've missed, and you know, the events, the attractions, the restaurants, the museums, the brew pubs, the wineries. I think you get the idea. All those places are now opening up and ready to welcome you. Now, if you have any trouble finding out something really fun to do this year, we have a really great solution for you. Governor already mentioned it. It's the Nebraska Passport Program. It's in its 12th year this year, which is astounding. We started May 1st. It'll end September 30th, as the governor said, and there are 70 stops across the country. Now, everybody's been talking about the last year about all this pent-up demand to go and travel and things. I can pretty honestly say that with the initial reaction to the passport program this year, we know that Nebraskans are not only ready to go, they're already going out. For example, we print 50,000 of these guides, and right now we just went over 40,000 of the guides already been spoken for. Our app, we have a passport app, we have over 10,000 people who've donated that, and have upwards of, coming up on 20,000 people who have actually clicked a passport stop. That means they have to be at these places. So everything is really rolling, really moving now, and we're really encouraging people to get out and travel this summer. 2 weeks ago was National Travel Tourism Week, and I traveled what I call coast to coast in the state, and I can tell you the industry's ready. I've got 10 passport stops under my belt already, have quite a few more, but I'll get to them. And the people in those businesses are just excited that people are coming in, talking to them over and over again. We had one place with over 100 people already from the passport program in it. So get out and have fun this summer. Support the businesses across the state. Restaurants, attractions, everything, they really need a little boost this summer, and now's the time to do it. And let's reconnect with everything that's Nebraska this summer. Thank you very much.
Thank you very much, John. I love what you were highlighting there with regard to all the great events, like the 100th anniversary of the Burwell Rodeo. That's a big deal. Of course, we're going to have 100% capacity at the College World Series. Also, Garth Brooks, I believe he sold out in 90 minutes, so 90,000 people will be at Memorial Stadium in August. So we do have a lot of great events. The swim trials, we have a lot of great events that are coming up here in Nebraska to be able to reconnect with as we return to normal and move forward. So thank you very much, John. I appreciate it. Nebraska Passport, great deal. All right, so with that, a couple of other announcements real quick. Just that with regard to, so Nebraska passport good, vaccine passport bad. So just want to be clear that as we're encouraging people to get vaccines, that I still strongly oppose any attempt to have vaccine passports. That is something that there's just some people who cannot get vaccinated. Getting vaccinated is a personal decision. You will want to consult your doctor if you've got concerns, but that's a personal decision, and so we should not be discriminating against people who are not getting that vaccine through things such as a vaccine passport. So I want to, again, reiterate my opposition to vaccine passports. Also want to note that, again, this will be our last COVID briefing, yay. And tomorrow we are going to be doing a bill signing at 2 p.m. over the governor's residence. The plan is to do that outside. If it rains, we'll be inside the rotunda. But the idea there is to have a bill signing tomorrow there at the residence, so please stay tuned for that. And with that, we still do have some questions that were submitted ahead of time, so we're going to hit those. And this will be the last time we do this as well, because guess what? We're returning to normal. So first of all, we'll go with Julie Anderson of the Omaha World Herald. Nebraska recorded 549 new cases of COVID-19 for the week ending Saturday, according to the CDC data. That's the lowest figure since last April. What are your thoughts about that? I think that, again, we're moving forward. We're ending the DHMs. We're canceling the executive orders. We're pulling out of the pandemic unemployment program. We're moving forward. Also, the pace of vaccinations has slowed considerably in the state. Do you have any plans to help get that moving? $1 million lottery prizes, free stakes. We are not going to be doing anything like that with regard to those types of incentives. Obviously, if businesses want to do that, that's up to them. But at the state, we're just going to continue to encourage people to get that vaccine, to work with the providers to make sure that vaccine is readily available. I was just listening to the radio this morning. I heard Hy-Vee doing an ad talking about how you could just walk up and get a vaccine while you're doing your grocery shopping. So that's a great example of how we're going to make it easy and accessible for people to be able to get the vaccine. And that's what we'll just continue to do, is make it easy, accessible for people to get it. And we're not going to be giving away free stakes or anything like that. All right, and then John Chapman, WWT. The Nebraska Department of Health and Human Services is proposing changes to child care regulations. Child care providers are concerned about the proposed reductions in the number of children allowed in a room. My question, why are the proposed changes happening now? And will those changes only affect child care programs that receive subsidies to help low-income families obtain child care? Who makes the final decision, and who funds the child care development block grants? So the proposed regulations are to bring us into compliance with the federal program that provides dollars. So we're going through that regulatory process. That's why we have a hearing. And we got lots of great feedback. We encourage people to continue to give us feedback. We're going to be reviewing those regulations in light of the feedback that we had. And so I will be going back and reviewing those regulations and coming back with some changes based upon that feedback. So that process is still in process, but the reason we're doing it is to make sure we're in compliance with the federal regulations and continue to receive that federal money. All right, with that, we'll go ahead and move on to questions and answers here in the room. And just a reminder, we've got the First Lady and John Ricks here to answer questions as well.
Mayor, why are you ending the $300 a week unemployment, and what would be your response to people who would say, hey, employers should just raise their wages rather than discontinue this program?
So the question was, why are we discontinuing the 300-week unemployment benefit? We are discontinuing that because we're returning to normal. And we see that Nebraska has the lowest unemployment rate. We averaged the lowest unemployment rate throughout 2020. We have about 39,000 job openings out there right now on our Nebraska Works website. We've got about 15,000 people receiving benefits, so we've got more than 2 jobs for every 1 person on there. So it's time to return to normal. And for the people who say, employers should raise their wages, I certainly think employers should pay what the market demands to hire people. The government should not be interfering with that by artificially driving that number up by providing an additional $300 a week. Yeah, Grant.
How many people are currently on the pandemic assistance program, and has that number declined? What's it right now compared to what it's been?
Well, Grant's question is about how many people are on the pandemic unemployment program right now, and I happen to have John Albin, our Commissioner of Labor, in the audience to be able to answer those questions. So, John, can you please come up and give us the specifics?
Yeah. All right, the numbers. Currently, the PUA, the one for the gig workers and the self-employed, 2,473 people as of the week ending May 15th. The PEUC, the extension to regular UI, is 4,839. And of course, everybody's eligible for FPUC if they're eligible for one of the other programs.
That's the $300 per week, right?
The $300 per week is the FPUC. So that's the numbers for the people that are claiming under each of these programs. If you're old, everybody, go ahead.
So how many are getting the 300?
Everybody who claimed last week and was eligible gets the 300, because that's.
How many people was that?
And our total claims last week were 15,837.
John, what have you done to, I guess, maybe recapture some of that money that might have been fraudulently given out, awarded, and what have you done to tighten up, the security on it?
Well, one, I want to emphasize again, Nebraska did not get hit with the fraud like most states did, or like many states did. If you look at the national rate right now for fraud, for regular claims, and it probably follows fairly closely in percentages for the pandemic claims, it is 5.43. Nebraska, or 5.61. Nebraska is 2.43. So we've been way below that rate. We did a lot of things early on that prevented a lot of the fraud that you saw elsewhere. When USDOL told us that we couldn't ask for income verification, we said, okay, if that's the rule, that's the rule. But you didn't say we couldn't ask for identification confirmation, so we started pulling people in to the offices that were filing the pandemic claims. First, we started with the ones that looked a little fishy. That saved us $16 million for sure, probably $85 million if those people would have claimed out to the end of their claims. We were one of the early onset states in terms of getting more people back in. We accelerated the program. We were requiring verification for our PUA claimants and our regular claimants before Congress finally got around to saying, oh yeah, you really should do that. So We were ahead of the game a lot that way. We have a very good vendor for our unemployment program. I am told, I am not an IT expert, but I'm told that our system withstood the bots challenges to the systems much more better than most systems did. I think basically because ours was not a COBOL-based program, and the COBOL-based programs really, it was difficult for them to build a defense against that. Another thing that Nebraska did, it's kind of old school, but we were one of the first states to reimpose the work search requirement, which made it a lot more difficult for the fraudsters, because starting last July 12th, if they were going to defraud Nebraska, they still had to go through and fill out 5 reemployment activities, which I think some states still have not reinstated their work search. So if you're going to steal from a state, why not go to a state that makes it easier for you by not requiring a work search? We're also one of the few states, now I think we are probably the only state that kept its RECIA program, the Reemployment Services Program, going throughout the pandemic. We made a pivot to virtual services rather than in-person services, so we didn't have to worry about people feeling uncomfortable coming into the job centers.
These are the job coaches that help.
These are the job coaches. And we kept that program going throughout the pandemic, which was a market difference. And then the other thing was we kept all of our local offices open so people could come in and get services.
And again, that withdrawal, we give the federal government 90 days or 30 days notice, and so that will become effective June 19th.
Do you think people are resisting going back to work because of the $300 a week benefit?
I do think that the 300-week benefit creates a disincentive for some people to go back to work, yes.
How much did that figure into your decision?
Well, we're returning to normal, so it's part of the overall decision-making process of getting people back to work, which is what we want. So it wasn't the only factor, but it's part of the decision. Yeah, Andrew.
Just to make clear, are you declaring victory over COVID in the state?
Well, I think that Andrew's asking if we're declaring victory. I think the way to frame this is we're returning to normal. We want everybody to move forward to return to normal.
And what was the key factor that made you decide this was the day?
Well, as we looked at our declining cases and our hospitalizations and the number of people that have been vaccinated, a combination of all those things together lead us to believe that we're in a position right now that we can return to normal, that we're obviously still going to continue to encourage people to get vaccinated, but the things that we did to preserve our hospital capacity are not going to be necessary anymore. So we're encouraging all those organizations, and we really appreciate the work they've done to be able to help slow down the spread of the virus, but we're encouraging all those organizations that have taken those pandemic requirements to move forward and to really return us back to normalcy. Yeah.
Are you going to urge those who are not been vaccinated to continue to wear masks?
With regard to people who have not been vaccinated, it'll be a personal choice if they don't want to wear a mask. Generally, if you go talk to, for example, the folks at UNMC, masks are something that we do on a broad basis to help slow down the spread of the transmission. And certainly it can make a difference for an individual, but it's really going to be a personal choice with regard to wearing that mask going forward. Grant.
Can you sort of walk us through what the repeal of each of those DHMs does? Because I was under the impression that you already sort of lifted the coronavirus restrictions, social distancing restrictions. How is this different? What do you do here?
So there's 3 different pieces here, right? One is the pandemic unemployment, which we just discussed. That's June 19th. The second one is ending these executive orders, which will end June 1st. And so those are the specific things with regard to regulations, Grant. So those are the things, whether it's the motor carrier regulations, the exemptions we've given there, or the alcohol ones and so forth. Those were specific executive orders that I wrote, that I signed, to waive certain regulations or waive statutes to be able to help us get through the pandemic. And so those regulations or statutes will become back into effect on June 1st. Then there's the directed health measures, the DHM. Those were the things that we promulgated to be able to help slow the spread of the virus. The only one we essentially really had left in the DHM was the requirement to quarantine or isolate. And so we're going to be, that will end as of 11:59 this evening. And health departments will still be able to go through their normal process of asking people to quarantine and isolate, but they will have to go through that the normal course of business like they did before the pandemic and the emergency and so forth.
We have a couple of questions that have been submitted. Don
Yep.
Walton, similar to what Andrew's asking, is, are you declaring the pandemic is over, or is coronavirus something we're going to have to live with?
So Don Walton, the Journal Star, is asking, is the pandemic over, or is coronavirus something we're going to have to live with? I would think about this as kind of the flu, right? Every year we have a flu season. The coronavirus is going to be part of what we experience from now on. It's a virus. It's, as the folks at UNMC told me 15 months ago, you can't stop it, but, and it's not going to go away, but we can take the precautions like getting vaccinated that will slow it down. And ultimately, the goal was to preserve our hospital capacity, and we've successfully done that.
Ruta Olsonide from KMTV has two questions. She says, 6 months into the vaccination effort, how do you think Nebraska has fared this past half year with vaccinations, and what would you like to see in another 6 months in terms of vaccination?
Rudy Elson is asking, how has Nebraska fared with regard to getting vaccines? I think we've done very well here in Nebraska getting people vaccinated. As I mentioned, we've got 53.7% of the population that is fully vaccinated, that population that's eligible, that 1.48 million. 975,000 Nebraskans have received at least one vaccine, and we encourage people to continue to get vaccinated. So over the course of the next 6 months, as people get comfortable, we encourage them to get the vaccine. Vaccines work. They absolutely work. They will prevent hospitalizations. They will prevent death. So please get vaccinated. The older you are, the more at risk you are. So again, 84% or 94% of our deaths occurred in people who are 55 and older. So I would certainly ask people who are in that age category, 55 and older, to prioritize getting that vaccine.
And then Ruta's last question is, this week, city mask mandates are expiring. Health experts believe the mandate has a significant impact on reducing cases. Do you agree with that?
So Ruta's saying, hey, mask mandates are expired. Health experts say that masks had a significant impact on reducing cases. Masks by themselves are only one aspect. Remember, let's go back 15 months. We talked about that Swiss cheese. It was multiple layers of things that we did. It was asking people to keep that 6 foot of distance, to wash their hands often, to, when you're inside, try and prevent, getting that close contact. Masks were part of that overall strategy. Masks by themselves were not going to slow the spread of the virus. So it's part of that Swiss cheese layers of different things that we did that helped slow the spread of the virus. Yeah, Andrew.
What happens if we have an uptick? I mean, could you bring back some of these executive orders and some of these mandates or health directives again?
So the question is, if there is a surge in cases for whatever reason, would we be able to bring back these executive orders and so forth? And the answer is yes.
Is this happening quicker than you thought?
The question is this happening quicker than I thought? This is one of the things I never really tried to do was predict too much what would happen with this virus, because it's just that, it's a virus. And we had no experience with this particular virus, and we hadn't in this country fought a global pandemic like this in a century. So rather than worry too much about what time frame, we looked at the data of what we're looking at right now to make decisions. And that's where, again, if we're looking, and we focus specifically on hospitalizations. That was our North Star throughout this entire pandemic, and that was a successful measurement to focus on, because that's what allowed us to provide that care. So we are where we are. I didn't have any prediction of when we'd be able to get to this date. We knew we'd get to this date someday, but I did not know when it would happen. Paul.
So this is your first credentialed news conference. Have you turned down anybody? Is Noise Omaha going to be approved? What can you say about that?
So actually, Paul, it's not our first credentialed news conference, our first with the new credentialing system. So we had credentialed news press conferences before. This is our first with the new system. And the question was, do we turn down anybody, Taylor? I don't believe we turned down anybody, and I don't believe Noise applied.
We still have applications we're reviewing.
And we still have applications we're reviewing.
But they haven't applied.
We've not received any applications.
Yeah, Andrew.
Because I haven't asked the hypothetical yet.
Don't ask, Andrew, I don't answer hypothetical questions.
Are you going to sign the casino?
With regard to the casino bill, well, we've got a number of bills that have come over. I think there were some 50 in each of the last couple days from the legislature, and we're doing bill consideration over the course of the last few days. So we'll be going through all those bills, so I would say just stay tuned with regard to all those bills. We're doing our bill consideration over the next couple days. Paul?
Can you articulate the reasons why you oppose that developmentally disabled bill?
So,
And if that's not the answer, what is the answer?
so the question was, why did the Department of Health and Human Services and my office oppose LB 376? We testified early on in the hearing in opposition to it. Let's take a step back. One, in my budget, I had added more money into the development, the budget to be able to address services with regard to developmentally disabled. Chairman Stinner added even more money on top of that, so we had already been increasing the amount of funding to address these services. And in our conversations with the legislature, we said if you wanted, and we've got plans to, we're working on plans to how to address these issues, but if the legislature wants to work collaboratively with us, that's great, but what I felt that the plan they were doing was not well thought out compared to the work we were already doing. And again, we'd already added money in twice, essentially, for this program in this budget. When I did it, and then when the Appropriations Committee did it.
What is the answer then? Just more money? I mean, this would access some federal money, that might help.
Well, again, we got to be very careful when you're talking about these programs, Paul, that you're not taking one-time money. Federal money that is not sustainable is not going to be able to help us long-term. So we've got to put together long-term plans for how we do anything in state government with regard to providing services.
The concern was that this would have been a continuing program that the state would have funded, and that was the projection.
Well, certainly, again, this is a continuing program. We continue to provide services to folks with developmental disabilities, and we work on, we've created a program and a process with regard to how people get those services. It's based upon application date. It's a fair system because it is something that everybody can understand. You get in line when you apply, and that's how we process, the applications to provide those services.
But just to be clear, the concern about LB 376 was it would have set up something that you would have had to pay, the state would have had to keep on funding.
So LB 376 added more money into the program on top of what we had already added into the program, and would have continued to pay, would have created additional, funding streams, right, without really taking a step back and do the consideration that we encourage the legislature to do to, work with us on a plan. Andrew.
I guess how do you get that waiting list down so that it's not, 8 to 10 years?
Well, again, that's one of the things that, addressing the plan, but that waiting list has been addressed several times in the past. And again, it's an ongoing process. As people apply, you've got to adjust your systems, and you've got to be able to do that. So we're certainly willing to talk with the legislature over the course of the interim about how to address these needs, but that's the conversation that needs to happen that did not happen before this year.
And when will state employees be required to work at their offices again? Do you have a
So,
date?
yeah, so we're asking all of our teammates to return, unless their jobs normally involve them not being in the office. So we do have some folks, for example, who work remotely because, say they're a bank examiner and they go out and go to banks. Those folks obviously don't have to return to the office. But everybody else, we're asking people to, we've already been setting this up with our agencies, but now we're asking all of our state teammates to come back into the office.
But do you have a solid date when you want that to happen, or is it?
Well, we're directing our agencies to do it right now, and obviously, there may be some consideration for space or other things, but we're really saying effective immediately, the expectation is everybody's coming into the office.
Does the state really have that many employees who are working remotely, do you know?
Yeah, we do have some people that are working remotely, yes.
A large number, or?
I don't know the number off the top of my head, Grant. We can probably get that for you. Taylor can follow up with you. Yeah, Andrew.
What happens in Test Nebraska now?
What happens with Test Nebraska? We will continue to provide Test Nebraska. I believe we've got the contract signed through July, and we'll reevaluate that. But we've seen that the demand for Test Nebraska has been declining, as our case has been declining. And so we'll be looking to wind that down when the contract runs out, probably. Any other questions?
Did you do anything to reconnect with Nebraska so far?
Have I been doing anything to reconnect with Nebraska so far? Well, actually, I have seen the number of events I've been able to go to has been increasing. In fact, I had a day last week where I had 6 different events to go to. It was like a normal day of being governor. It was very exciting. It included wrapping up the day by cutting the ribbon at a new drive-in theater in Valley. So all very, the Quasar. So the only one in the Omaha area that's operating on a regular time basis. It was very exciting.
She could do some celebratory dinner, you know, you didn't saddle up a few more.
No, but I've been looking for more opportunities to be able to get out and do things. So we're going to continue to look for opportunities to be able to do that. Looking forward to the Seward 4th of July parade, for example. Cattleman's Ball. We'll be going to the Cattleman's Ball, June 4th. Doing Ralston too. Oh yeah, it'll be a normal 4th of July. All right, any other questions? All right, folks, well, again, thank you very much. Francis, thank you very much for all your help throughout the course of this pandemic. And thank you, everybody. I want to thank all the Nebraskans who have worked to be able to help make sure that we've been able to slow the spread of the virus. Suzanne thanked our healthcare workers. I want to also put in my thanks as well for all the work they've done to be able to help keep people healthy through this pandemic. Thank the Nebraskans who have sacrificed so much to be able to get us to where we are. This will be our last COVID briefing. So that is a very exciting endpoint, and we look forward to moving together to be able to return to normalcy. Thank you all very much, and remember, Reconnect Nebraska.